Can I welcome everyone back to Plenary? We are such a community with one another that it's hard to get everybody back on task and away from our networking, which has certainly, among all of the family and friends we have here, been one of the joys. You're going to keep seeing me with different hats on. I'm going to put on my USAID alumni hat right now in order to introduce our next speaker. I was in a long time past at the beginning of PEPFAR, the Assistant Administrator for the Bureau for Global Health at USAID. And so I'm really excited to have Dr. Alma Golden, who is currently the Deputy Assistant Administrator in that same bureau, speak to us today. She's a pediatrician. She has taught at Texas A&M, and she's been involved with PEPFAR, starting with the mother-to-child transmission prevention, and then has led through the last few years. Many of you know that working at AID, working in Washington, as we mentioned last night, has a lot of controversies. I've been in the middle of some of those, and almost always there are more sides to the story than one knows about when you hear in the press. And I'm sure many of you have seen and have been concerned about the New York Times article about the breastfeeding and the U.S. Role in the breastfeeding resolution at the WHO. Dr. Golden got to live, walk, breathe through that whole thing, and she can tell us a little bit about what happened, but she also brought copies of the resolution itself so you can look at it. I will say that as a very strong breastfeeding advocate, I taught breastfeeding with my young child that was born in Kenya, 2 Kenyans, so I am a strong breastfeeding advocate. The final resolution looks good and it looks really strong. So CCIH as a board, as an organization, when we saw the controversy, we did the due diligence of looking at, is this something we need to advocate around? So I'm pretty comfortable with the resolution that was passed unanimously by the WHO, but you'll have an opportunity to hear from Dr. Golden, and I have copies of the resolutions for those of you who want to really dig in and look at it for yourself. So with all of that said, I'm really excited to welcome Dr. Golden to our session this afternoon. Thank you.
I rattled my way up here. Okay, so thank you. It's an honor and a pleasure to be here today, and I'm seeing several familiar faces that I had a privilege of working with before, so it's truly exciting to be here. I also want to extend a greeting from Garrett Grisby. He and I talked yesterday, and he said he was wanting me to tell you just how much he missed being here, and so he is hoping to be able to come back next year, and also looks forward to hearing from you and kind of listening to your interests and concerns too. And indeed, Garrett and I did live through the Geneva experience together, and I think that I just encourage you, rather than spend a lot of time talking about the resolution, because there's so much else, please get a copy. I think you'll be really pleased with what came out of that, and it was a unanimous decision. And I think there's also another article that was released yesterday in The Hill, and it has a little bit of a framework in terms of, and they even referred to me in that one. So I am never excited about getting in the news, but I made it that time. So you may want to review that, because it kind of gives a little different framework so that you can understand a little bit about where it came from. But there are always controversies, as you indicated, but there is so much that we have to do together, and so much of it is so promising as well. So I'm going to talk to you a little bit about 3 things today, and I'm going to try to keep talking fast because I've already been warned. I have a timekeeper here, so that's good. And I want to talk a little bit about the strategic advantages that faith-based groups bring to development. I want to talk about that first, then I want to talk about some of the things that USAID is doing now that you might want to know a little bit more about, and then we're going to talk a little bit about what it is that we could do together as we think about the future. When you think about what are the strategic advantages of faith-based groups in development, I think the first thing that comes to mind is just the history. Some of us at USAID have bragged that we've been doing development in health for over 50 years. But if you look at that in comparison with what's happened in faith-based groups, we don't hold a candle. And there certainly, within the last couple of hundred years, there have been so many different efforts all over the world where faith-based groups have really made such a difference in terms of how they've ministered to people. But I also recognize that if you look all the way back to Matthew 10, and you look at the verses 7 and 8, you'll see that Jesus said, "As you go, preach, saying, the kingdom of God is at hand. Heal the sick, cleanse the lepers, raise the dead, cast out demons. Freely you have received, freely give." So the very first commission to reach out and tell about the kingdom of God was, the first thing on there was heal the sick. So in some regards, the mandate for faith-based outreach in health is really over 2,000 years old. And I think we need to acknowledge that if we really want to talk about the impact of development. The second thing that you bring as a strategic advantage is knowledge. You really understand the countries that you're working in, you understand the cultures you're working in, you understand what their needs are, and you understand what are some of the effective ways to reach them. And you do that in a true living there environment that really we need to learn from. The next thing that you bring as a strategic advantage is trust. People have learned that what you say is what you mean, and that what you offer to them is out of genuine compassion. And it builds a lot of trust, and it builds a lot of respect. And I think in a more significant way than sometimes you see for just sort of a do-gooder type thing. It's truly, you're coming with your heart in your hand, not just a handout. The next thing is you bring experience and positioning. Sometimes you've gone to the hardest to reach places, and you've actually positioned yourself in spots where nobody else has much of a foothold. And that's really a critical thing as we look forward to more development. One of your great advantages also, and I call this is actually advantage number 5, if you were keeping track, is that you have partnerships. You have partnerships that really reflect a very deep base. You're partnered with churches, with organizations, with all kinds of different, even private entities, where you bring a network with you when you come. And that network actually involves volunteers as well. It's harder to get volunteers for other groups sometimes, but faith-based, when you have a framework of value and trust, you can really appeal to volunteers in such a heartfelt way. The next thing you bring, your sixth strategic advantage, I guess you would say, is that you have motivation. There's a genuine sense of compassion that comes with it. It's not a business deal that you're going out to do. You really are doing it out of your heart. You're doing it out of the calling on your life. And in all honesty, when 40 years ago, I always thought I would be sitting there. My goal was to be a missionary. I wanted to be in Africa. I really thought I would be. That was the call in my heart at that time. And through a series of really disappointing experiences, I didn't get to go. So as a result, what I did when I went into private practice is I started seeing children with the county health nurse in a free clinic on twice a month, as often as I could get the county health nurse to join me. And I did that until I took a job with the University of Texas Medical Branch, and I ran maternal child health clinics for 10 years. And I put clinics in 16 locations, and I hired nurses and wrote protocols and managed the programs across South and East Texas with the university. But the motivation of my heart was not just to go set up a system. It was the same thing that I had when I wanted so badly to go internationally and do medicine. And that really brings us to the last point. The last strategic advantage you have is you have a long-term vision. you know where you want to go with this. Because as we were told in Matthew, we're going to offer the kingdom of God to people. It's not just being physically well, but being emotionally, socially, and spiritually well as in addition. So, if you have all those advantages, what is it that USAID is doing, and then what can we do together? Anne may have given you all of the tutorials you need on USAID at some point in the time past. But basically, just to give you a sense of structure, USAID is the development part of the United States government, and it's inside the Department of State. Okay, so in the Department of State, over on one side of that's development is the United States Agency for International Development, and in that are bureaus. And those bureaus have different jobs. Some of them serve regions of the world like Asia or Africa or Latin America, and others kind of serve specific functions like health or education and energy or policy and so forth. The Bureau for Global Health is actually the largest of those bureaus, and we operate over $5 billion worth of funds every year, and that includes a lot of the HIV as well. So what are the things that we do inside of the Global Health Unit? Some of them that you already know a little bit about. We run part of the PEPFAR, of course, as Anne was alluding to. And that of course, has prevention and treatment and all of the different, did we just? See, I really am not doing a presentation. Okay. I spent so many years teaching at the university where I did PowerPoints continuously. I got to tell you, I'm a little burned out on PowerPoints. And beside that, I'm not nearly as good at it now as I was then, I'll tell you. But if I need help, there are plenty of millennials that are around me that can get it done. Okay, so some of our focus areas. We have maternal child health, and we have with that, of course, immunizations and nutrition. We have the HIV, as I mentioned. We have the President's Malaria Initiative that's associated with our office but has some separate functions and independent coordination as well. We have family planning. We have neglected tropical diseases. We have the Global Health Security Agenda, TB, and across several of those are several things that we worry about. Okay. Anyways, to tie a lot of those together, we have several different departments that kind of support everything, like research. We have health system strengthening. We have, you already mentioned, the gender-based violence, and so we kind of have a gender office that talks about violence against women and girls, which I know Debbie and I have had many in-depth discussions about, and we appreciate your help on that. We have data, and we also have collaboration with multilateral organizations like UNICEF and WHO and the PAHO and G7 and a lot of those things. So we have an opportunity not only to engage in services, but we have an opportunity to engage also with policymaking across inside the government and across different governments as well through the multilaterals. So those are some of the things we do. So now then, what should we do? And see, I'm at 5 minutes, okay? So I'm trying to stay on time. We have to have a vision for working together. It's something we've been trying to talk about a good bit over the last few months, and several of you have participated in discussions at my office or with the administrator's office looking at what is our vision for going forward. Our administrator, Mark Green, has a phrase that he uses very often, and that's the journey to self-reliance. He has really pushed all of us to not only look at what we're doing right now, but how does that help the countries assume their own care, to develop their own capacities, to be sure that they're truly resilient and sustainable in what they do. And I believe that one of the reasons that we have a connection between faith and this particular administration with Mark Green is that we all share the goal that we want the folks that we work with to be truly have a great capacity, have a great resilience in what they do. We want to be sure that we do address the immediate needs as they stand right now, but we always do it with an eye toward tomorrow. We want to be sure that we're aggressively equipping the leaders that's actually in line with what they care about. We want to be sure that we're not just going in and telling them they have to do it the way we tell them to do it, but helping them recognize what their needs are so that they can develop and adapt and maintain processes that are meaningful to them and will be sustaining for a long time. We also want to be sure that we're maintaining collaboration throughout, and this is also another big piece, because it's not like we just want them to set them up and walk away. We need to be able to change from being a donor or a compassionate caregiver, and as some faith-based groups are. We want to go from being that caregiver to that equipper, to that friend, to where we can also actually end up being like co-equals before God and everybody else in terms of how we get things done, but also responsible to the countries we serve in as well as the governments that we care about. So, how do we improve the links between the faith-based organizations and the United States government? I'm going to suggest about three main things. One is that we inform each other. We need to learn from you. Some of you have been in meetings already with me to provide some input so we know what your needs are. We also need to talk about what are our resources. We need to make clear to you when we do have awards coming out and how you can apply for them. We're working right now on some training some training videos and materials. We're reviewing some from the past and looking toward the future so that we can actually improve those. And we also want to inform each other about what works and what doesn't work in implementation. So we also recognize that as we inform each other, we want to look for new opportunities. What are some ways we should do it better, and we could do it more completely, and we can actually complement each other better between the faith-based and government-funded donors. And then the last thing is, I think if we could share volunteers, if you could help us know where issues are, or if we can help you, so that if we have a need, let's say in one of the universities, and you have a volunteer with your group that has an expertise in that area. I'll use an example of one of my dear friends. She's a pediatric anesthesiologist, and she loves to spend between 4 and 6 weeks a year in a mission hospital. And she is such a great resource. But it would be really nice if we could say, okay, the faith-based group sets up the meeting, and then we say, here's some extra materials, or here's some support pieces that may help you in that hospital when you go there, whether it's guidelines or whether it's resources and equipment or whatever it is, so that when we recognize a need, maybe it's filled partly by a volunteer and partly through some of the coordination that we can do with USAID. So I think all of these things work together to be sure that we actually fulfill what it was that Matthew 10 is talking about. Because if you look at what you are doing now, there is a great blessing associated with that. And it's best said, I think, in Matthew 5. Blessed are the merciful, for they shall obtain mercy. Blessed are the pure in heart, for they shall see God. Blessed are the peacemakers, for they shall be called sons of God. Blessed are those who are persecuted for righteousness' sake, for theirs is the kingdom of heaven. And I think it's very fitting that not only was the first mandate say that the kingdom of God is at hand, but the blessings on those of you who already do the mercy and the peacemaking and the guidance are promised that you will receive the kingdom of God. So thank you very much, and I will be glad to take some questions. It looks like I've got I talk fast.
I think this is where I come in to help facilitate that part of it. So thank you, Dr. Golden, for being here to make those really compelling remarks and to inspire us. I've taken some beautiful notes, and I was tracking all 7 of your points there, so they'll be a nice part of my framework. Let's open it up for some questions. I'm sure that there are a range of them here, so please.
Please introduce yourself.
Yeah, please
Hello.
introduce yourself, as Mona said.
Can you guys, yeah, my name's Chris Panico. I'm with URC.
We know that there's a lot of changes going on right now at USAID, especially with trying to look at alternate funding mechanisms and increasing collaboration, co-creation, as well as incorporating a lot of faith-based initiatives and the private sector into more of what USAID does. Can you give us some practical examples for people and leaders in this room, leaders of health systems, leaders of faith-based NGOs, how they can start to take action now and engage you and not wait for whatever comes out, but to prepare for the collaboration, the co-creation, and to help you guys maximize the use and engagement of faith-based initiatives?
I think there are a couple of things that would be useful. You do have in this room and around several folks that have experience on writing grants for the government. Even if we change a lot of things, like we're going to go to a co-created format with what they call BAAs, broad agency announcements, or other things like that. When you get to the actual writing of the grant, the fulfilling of all those lists of requirements, and all that reporting and everything, we're not going to be able to change those. So to get ready to write those, to write a successful proposal, you need to go ahead and get familiar with what those components are. And I think look for some of the smart people in this room that actually know how to do that and can help start teaching for that test, I guess you could say. The second thing would be to look for ways that perhaps you could work under an umbrella for the first few episodes of funding. I see Ann shaking her head. Because the reporting burden, the writing and the reporting burdens and the auditing burdens can be pretty substantial. And if you're doing it as a collaboration, where not everybody has to write something, you can roll some of it together, that would be an option. Remember, though, when you do that there's going to be an incredible focus, and Debbie Price said this last night, on equipping local partners. And so if you can start creating under that umbrella, not just American-based groups, but also your local groups, your indigenous groups, that would be amazing. So I think doing those three things probably would kind of speed things up. Yes, sir.
Please. Over here. We're going to have Perry running back and forth a lot here, so he's got his running shoes on. That's right.
Thank you very much. My name is Yoram from Chaz, Zambia, and my reflection on faith and work in health is that we suffer from a paradox of capacity. When there's no money, we do the work. When there's money, suddenly we don't have capacity to spend the money. And when the money finishes, the work is returned to the FBOs. And I have seen this even with HIV. Before there was big money, the church was at the forefront of it. When big monies came, the churches were put on the side for whatever reason. And after the recession, when the money has started to dwindle, suddenly it's time to go back to the church. How do we fix this paradox? And this is, I'm only asking you because I think your opinion on this, because I think you are in a very privileged place because you rub shoulders with these big money institutions and you are yourself are part of that big money institution. You are making a big decision in going local.
Yes.
It's a very big decision to go local, and especially at a time where most of us at a local level started developing this attitude towards USAID to say, even when there's a call for proposal, it's just a formality. They've already decided.
Oh.
And it's at country level, it's very real in our heads that USAID forget. And sometimes you co-write a proposal as a partner, and when the proposal is approved, what you had proposed changes. And sometimes you have these exclusive partnerships where you are saying, when we are applying, you don't apply with another person, were in a marriage, so you don't go to others. And then the funding comes out, and then you find yourself out of the door. And the person, the institution you wrote the proposal with gets all the money and starts implementing, and you are told, USAID has said we can't work with you, so we're going to choose others. So this is the reality on the ground, and I think your good intentions on top, from what I've heard yesterday and what I'm hearing today, you have very, very good intentions. The question is, how do we ensure that these good intentions get on the ground?
Okay.
And how do we ensure that this very nice illness that you have of going local becomes a global phenomena in helping churches forward the good work that they do?
I love it. Well, I think I actually was wishing we had that recorded. Do we have it recorded? That's really good. And I will tell you why. I actually, one of the issues that we've come up against, and I've only been there 9 months. 9 months Monday, is when I came in October last year. And so I am becoming familiar with some of the particulars of history, and I need to hear all of the perspectives from history. And you did an excellent job on relating that. But you also created quite a challenge for us as well. And I will tell you that one of the reasons I have some optimism is that Mark Green, our administrator, actually worked in Africa for many, many years. And he started off as a school teacher in, was it Tanzania? No, it was Kenya, I think. And he spent like his first 7 or 8 years of marriage teaching school in a rural village. He gets it. He understands what the issues are. He also comes from a faith perspective himself. He's been very clear on needing to drive this back down to the local level, or it cannot be sustainable long term. And so at least as long as we have the strength of leadership that we do in the front office with David Moore and Bill Steiger and Mark Green, I feel very supported in moving forward. I acknowledge, though, that because of sort of the patterns for many, many years, we have to address the issues of bias or just poor structure to address the needs of faith-based groups. We're going to be putting together case studies that we are going to actually show to USAID workers as well, to tell them what the impressions are from outside, so that our own colleagues inside the organization recognize what it looks like from your side. And that's why I was thinking, I wish I had all that recorded. And if we could get that later, that would be useful, because it's hard to fix something if you don't know it's broken. And I think bureaucracies operate on a routine basis, and sometimes they really, really believe it's working. They honestly do. They don't think that there's any problem, but they need to be able to see it from the outside, and you've done a beautiful job of expressing that. I cannot tell you that I can fix everything, but I can tell you that I'm here today to make every effort I can. And I do need to hear your voices, and the pressure needs to stay on us. If we're not delivering, you need to go ahead and speak up and say, hey, you said we were going to get whatever. So stand with us on that, and I don't mind if you fuss at me again, because I think it's part of how we know what's going on and address things. Thank you very much.
I think it's worth mentioning, Dr. Golden, that on Wednesday, several of us including many members of the Christian Health Associations, will be meeting with you again at USAID. So thank you for offering some time.
Well, I'll try to bring some folks in. I will check on who all we can get in the room.
Super. Thank you. Yeah,
thanks.
great. Okay. Another question maybe over here. Microphone. And we have time for just a few more questions, so get yours ready.
Okay. I'll say that for us in here, we really want to praise God for you and for your presentation. It was fantastic. I just wondered if you could talk a little bit more on how international NGOs and local NGOs could work together in terms of getting USAID funding, but also what kind of policies or programs you have in there that promotes FBOs.
Okay. We don't have a specific, at least in global health, we don't have a faith-based separate area where we say this money is only for faith-based groups, but we are encouraging every one of those programs that I just read off to you, all the different, the maternal child health, family planning, and so forth. We're trying to encourage all of them to work with faith-based in each of those areas. I think the other issue is you mentioned about working with NGO and partnering. I would encourage you to consider that, but one of the things we're going to be doing as we move toward the co-creation process is we're going to ask those international NGOs to please set up their programs so that they start with partnerships with local groups, but then move the direction and the control to the local partners as the grant matures. So I think you may have some opportunities to partner with the NGOs in that regard, but you need to set your parameters clearly in terms of saying, we want to start as a sub, but we want to be part of the transition to local control.
Okay, I think one back here.
Thank you for the presentation. My name is Mark Strand from North Dakota State University and have worked supporting a lot of NGOs in the Asian regions.
Okay.
I have a two-part question. Connected with a lot of smaller nonprofit faith-based organizations in that region. They don't know how to get on the radar of any of the U.S. government agencies. And it's not as if they would collaborate intimately, but they want to be, one, known for what they're doing, respected, but they also want to know how to situate their work within the larger, like, national or regional arena. But it's very hard to get the attention of the government agencies or be respected by them.
Okay.
What do you recommend for, one, to get their attention and be given the opportunity to bring some organizations together to talk about these issues in a way that you're given some respect and also given guidance in terms of how to move forward within the larger landscape?
A couple of things come to mind. One of them is that if you would go ahead and start reading some of the documents as they come, or read the programs first. Read where the focus has been. Like, we've really done a clear focus on maternal survival, and we also have another focus on newborn survival. There are some areas around the need for social norming, like we said, on the gender-based violence and women's just fair and equal treatment of women, things like that. How to promote girls' education, some issues around just social norming, I guess you could say. Some of those you're going to see recurrent themes in several of the different grants that come out. And the faith-based groups have some wonderful advantages, especially around the issues that people have to trust you, to learn from you, and then to act on what you teach. And I think developing some special expertise and expressing it well is going to be helpful on that. So learn what we're doing. The second thing I think is what we talked about earlier. Learn what it takes to get involved so that you start understanding the scope of how grants work and how to operate them so that you don't get in trouble from the beginning by omitting something that has to be in it. And then I think go ahead and start looking for an umbrella group that you could put together for getting started so that you really have the potential to get in and do it fairly efficiently without a huge learning curve.
Can we do one more question? Would
If
that be
you
okay?
want to.
Just one more question. Any others? Going once?
There's one.
Oh, great. Okay, right over here.
Thank you so much for spending this much time with us. It's a pleasure. About 25, 30 years ago, there was a nice little program at USAID that was the FBO Matching Grant Program. And its intention was to help organizations that had not broken through to have an opportunity to get in. Because if you can't fill out that past performance section, with some references, it's really hard to ever win anything. And the PVO matching grant required the organization to put up some of the funds, which was great, and they tended to be small, so it was low risk for both sides. But it was an awesome way to get a nice little piece of work done, get some credibility, and create some relationships within USAID who would coach you. And I happened to be in an organization when I was very, very young that happened to be able to get one of those, and it just helped us tremendously. And it would be nice as the agency is looking at expanding the breadth of who can have a piece of this pie, and maybe with a few less zeros attached to the budgets. It might be a nice way to go. So maybe there are a few hands still around at the agency who might remember those days.
I will go back and check, but I'm also going to hand you my card as I walk out, and then I want you to send back the information to me on that, and I bet Ann can help me dig through some of that as well.
And there were child survival grant and new partner
Yes,
fund
yes,
at the
yes.
beginning of 2000, so there have been money renditions of this.
It all disappeared.
Yes, I know.
And there were matching grants in 1980s that I was on the USAID. Right.
So,
Wonderful collaboration.
so I think the challenge is with us now to do some follow-up on that and follow up with
Yes,
your office.
yes,
And so,
yes,
friends, we've really reached the end of our time. We have copies of the Acting on the Call report from AID that's in the back. I think back on the counter back there. So please, if you have not received it, get it and take a look. It's fantastic. So, Dr. Golden, and we'll put those back there as well, what Ann talked about. Thank you so much for being with us. Thank you for taking the time. I know that you also have some family commitments to move on to, so thank you.